Hi, I'm Carol, dental hygienist from the practice, and although it might have been a long time since I've seen you, since before lockdown and a little while before I get to see you again, rest assured I'm still here, and I'm still here to help you look after your own teeth and mouths at home. So I'm going to show you in today's video how to use a manual brush and also how to use the little brushes that clean in between your teeth. While I would prefer you to use an electric toothbrush, I realise not everybody has access to an electric toothbrush, or if you've got one, you might have run out of heads for it or not like the feeling of using it in your mouth yet and have reverted back to using a manual toothbrush. Let's just think about why we want to brush our teeth to start with, what we're aiming to do when we're cleaning. What we want is nice, clean, healthy teeth and healthy gums. All the time bacteria builds up around our gums and in between the teeth. Whether we're asleep or even during the day, it's constantly forming all the time. And if it's left on your teeth, it starts to cause damage and inflammation. We see that the signs of this are bleeding, maybe soreness of your gums, maybe bad breath. It also can contribute to diabetes, heart disease, stroke, kidney disease. So it's really important that we remove it every day. The bacteria builds up, the bacteria builds up around the edges of the teeth and in between the teeth. If it's left undisturbed, it matures and forms what we call a biofilm, which is a protected colony of bacteria, where the bacteria on the outside protect the bacteria on the inside. And it's these bacteria on the inside that cause tooth decay and gum disease. And while they might look very pretty, stained up under a microscope like this, it's not what we want in our mouth. It's very resistant to chemicals. So even though I might hear me saying it's a bacteria, we can't just have a mouthwash to kill the bacteria. We need to physically remove it, physically disrupt it by your brushing. Just like when you're washing up and you don't just rinse the plates underneath the tap to wash them up, you've got to brush them to get the debris off. Or if you're washing the car, you don't just throw a bucket of water over the car or hose it down, you've got to brush the dirt away. It's exactly the same with the bacteria in your mouth. It needs physically removing. We can't just use a mouthwash to chemically get rid of it. It's tricky to see. At first glance, you look at these teeth and they think, oh, they look nice and white and clean. But there is plaque there. It's hiding where you can't really see it. That's why at the practice, we put the colouring on your teeth sometimes, and indeed you can do it at home. It's called disclosing. You can buy little tablets that you can chew up and it colours up this biofilm, this plaque, so you can actually see where it is. And as you can see from this picture, it's forming mainly at the gum level and in between the teeth. So these are the areas where we want to concentrate on with the brushing and cleaning. Around the edge of the tooth and the gum, there's a little cuff of gum where the bacteria push underneath to cause damage. And it's a bit like, if I can show you, if you imagine my hand is your tooth and the sleeve is your gum, and here's the root of your tooth. So you've got your gum covering at the root of your tooth, but you've got a cuff between the tooth and the gum where the bacteria can get underneath. And it's that bacteria there that does the damage. That's where it's protected and it matures underneath. So that's where we need to sweep it away from every time when we're brushing our teeth and using the little brushes to clean in between. I'll start off with showing you how to clean between your teeth with the little brushes. There are various types of brush that you can buy. All I've got at home, because it's locked down, is the little pink one and this Wisdom Clean Between. So that's a pink TP with the little filaments on. Those ones are made by Wisdom, and they're called the Clean Between, and they've got like a rubbery filament. If I can show you how to use this in between, you can get different types, either the straight one, this is the same as the one I've got here, or with an angle on. They're different colours because they're different sizes, and there's a whole range of sizes of these brushes, going from really small for the very tightest gaps to a large one which is virtually the size, if you've got a tooth missing it'll clean in between that gap, so it's sort of a tooth sized brush. And you need to use one that's a tight fit between all of your teeth. Most people need 2 or 3 or even 4 sizes of brushes to be able to get round all of your mouth effectively with something that's tight. When you use them, the space between your teeth is triangular, with the base of the triangle nearest to the gum. So the nearer the gum you push that brush as you're pushing it through, the easier it is to get it through. So at the top, you put it near to the gum at the top, at the bottom, down a little bit nearer to the gum at the bottom. If you're struggling to get it through, you can twist it very slightly, and that will help to ease it through. So that's another little trick that you can use to help to get in between. Once you've got it into this space, about 10 brushes backwards and forwards for the whole length of the bristles of the interspace brush, putting a few strokes towards this one tooth, one side of the gap, and then backwards and forwards with a few strokes pushing the other way next to the tooth, the other side of the gap. So if I can just show you here on the model, backwards and forwards like that in between. The tricky thing comes is when you're coming to do the back teeth, don't try and go in from the front, otherwise you'll find that this brush will get trapped on the back, the tooth behind the gap, and it will crumple up. You need to move your brush round to the side a little bit to be able to clean in between. Now, what that means is you'll have to close your mouth very slightly to be able to get the brush to go through from the side. Don't do it with your mouth stretched really wide. If your mouth is wide, your lips and your cheek will stop you being able to access the back of your mouth to clean in between. Let's talk about toothbrushing now. I want you to use a fairly small toothbrush, one with a head size something like that, about the size of a pound coin, and with just soft to medium textured filaments on it. You certainly don't want a hard brush. If you spilt something on the floor, like rice or something in the kitchen, you wouldn't get a broom, a hard broom, to sweep it up. What you'd get would be a small dustpan and brush, something that you could easily sweep into the corners to get the rice up off the floor. And indeed, it's exactly the same with your toothbrush. With your teeth, there's all sorts of little shapes that you need to get into on the surface of the tooth. So you need the brush to be adaptable to get around those shapes. And also we want to be able to brush underneath this cuff of gum. So you don't want something that's hard, that's not going to be able to sweep underneath the gum at all. Let's look at the anatomy of your teeth and what you're aiming to do when you're brushing your teeth. Think about, you've got the outside of your teeth, the inside, the biting surfaces, in between your teeth and behind the very back teeth. So all of those surfaces are going to need cleaning. I'd like you to angle the toothbrush down. I'm going to show you on the outside just because it's easier for you to be able to see the angle. Angle the toothbrush down towards the gum at about 45 degrees to the tooth, not 90 degrees like that. You want it about like that, and so that the bristles are about half on the tooth and half on the gum. And then I want you to use a small circular movement, 2 or 3 teeth at a time, just slowly moving around the mouth like that. The bristles should be sort of wiggling to get in between so that they will adapt to go in between the teeth. and underneath the gum. It shouldn't be a long movement like that. That's a scrubbing movement which is going to cause damage to the gum and to the teeth, particularly on the corners. When people are right-handed, very often the left-hand side of the mouth, there can be some trauma there on the gum. Equally, if people are left-handed and they're brushing around like this, then the teeth this side can get a bit worn. So just a small movement, that backwards and forwards movement, little circular movement, cleaning everywhere. Be systematic, that's the most important thing, so that you know you've cleaned all the surfaces of your teeth. Don't run the toothbrush underneath the tap before you start. Just put a small blob of toothpaste on a dry brush and use that. Toothpaste, you want a fluoride toothpaste, something like Colgate Total or the Oral-B Pro Expert or the Oral-B Gum and Enamel toothpaste, or one that's designed for sensitive teeth if you do get that little bit of sensitivity. But a small blob on a dry brush, that's important. And ideally start brushing on the inside of your bottom back teeth. It stops the toothpaste foaming up in your mouth and making it like you're going to feel like you're going to gag. So let's have a look at going around the mouth and what sequence to use. I would say, so you've got your toothpaste on a dry brush and your mouth would be open about like that. So angle the toothbrush down towards the gum on the inside by your tongue. Make sure that brush is going on that inside edge, just in there, not only on the tooth. You need to be between the tooth and the gum, about there. So a small backwards and forwards movement, a couple of teeth at a time. And I hope you can see there the way the toothbrush bristles are getting in between the teeth, and that's why I'm saying to you, don't use a hard brush, because otherwise the brush won't adapt and get in between like that. As you come round to the front, put the brush up and down behind the back teeth, but behind the front teeth rather, there at the back of the front teeth, making sure that the end of the brush cleans on the inside there. Carry on then around exactly the same to the other side, and then the back of that tooth, that's a very common place for people to miss. You'll need to try and clean behind that back tooth, then come around exactly the same way around the outside at the bottom front all the way to the back. Then the biting surfaces. This is where there's the little cracks on the top of the teeth. They're called fissures, and that's where decay can easily start. I want you to, oh, that's the ice cream man. I want you to brush backwards and forwards on there to clear that area of debris as well. Then exactly the same at the top. When you brush the top, don't stretch really wide. If you do, the cheek muscle is tight up against the side of the tooth, and it makes it much more difficult for you to get the top of the outside. If you close about halfway, you'll find that this muscle relaxes and you can get your toothbrush in a lot easier. Angle the toothbrush up towards the gum, and exactly like that, cleaning all the way around systematically, all the way around the outside, the back of the back tooth, and then around the inside and onto the biting surfaces. If you've got teeth missing, I'll just give this model a quick extraction. If only it was as easy as that, eh? If you've got teeth missing, you've got to be able to clean in between this gap. So don't forget to put the brush sideways like that to clean in there and again on the front of that back tooth. And again, that could be the sort of area where you can have the very widest of the TP brushes, the black one. That can be used to clean in between the back teeth. I didn't show you the little brush with the filaments. Forgot to show you that. So here, that one is. This is the little Wisdom Clean Between Pro. So I'll just show you how to clean with this. It's tapered, So basically you pop it through in between just until you feel a little bit of resistance as it goes through, and again a backwards and forwards movement, massaging around the gum level and putting a little bit of pressure on the side of the tooth, one side of the gap, and then the side of the tooth, the other side of the gap. These again come in a few different sizes. They're small, medium and large, and you just want to be able to get it all the way through in between so that you can massage again that gum level and to clear the bacteria away from right in between. After you've brushed your teeth and used your little brushes to clean in between, you also need to brush your tongue. Your tongue is a reservoir of bacteria, and that biofilm will build up very quickly back onto your teeth. By brushing your tongue, brushing from the back to the front, it helps to increase the time that it takes before that biofilm builds up onto your teeth. So it's just an extra thing for you to do. So you don't need toothpaste or anything, just your toothbrush onto your tongue and brush that as well, and that's going to help to make your mouth feel cleaner and fresher for much longer if you can do that. You might have noticed some bleeding during lockdown, or when you change slightly to use these techniques, you might notice that you get a little bit of bleeding from your gums. Don't panic. The bleeding is there because the bacteria has already started to cause some inflammation, and your body is trying to mop up that inflammation by flooding some extra blood to the area to increase the number of white blood cells, which are your defence blood cells to get rid of the bacteria. It can't do that if the bacteria is constantly reforming around your gums. So if you carry on brushing and cleaning in between your teeth to remove the bacteria, then that will give your body a chance to get healthy. So even though you get some bleeding, even though it's a little bit sore, persevere, do continue, and within a few days or a week you'll find that any bleeding that you get will go away. It's not healthy for your gums to be bleeding, but the only way you will get them healthy again is continue brushing. So you will go through a period of bleeding before they'll get healthy. The other thing is, hang on, you might, let's go back. You might have experienced some build-up of calculus or tartar on your teeth during lockdown, since haven't been able to see you and the dentist hasn't been able to see you. Don't panic. What this is, it's hardened, dead bacteria that's been mineralised by some of the minerals in your saliva. In itself, it's not harmful to your teeth. Where it does become harmful is when it's covered in the live bacteria. So you continue to brush it, brush the live bacteria away, and then when the time's right, when you're in the practice with us, we can remove that hard deposit from your teeth when the time's right to do that. Don't be tempted to buy something off the internet or from social media that claims to remove this deposit for you. It's likely not to work, and you're likely to cause some damage to the tooth structure underneath. So don't do it. We know it's there, you know it's there, just brush it to keep it clean. That's the most important thing. Your job is to remove the bacteria while it's still live. And then our job, when the time's right, when you come back to the practice, will be to remove this dead bacteria and mineralised deposit. We can do that for you, and we will do it when the time's right. So to recap, what you're aiming to do is to have nice healthy teeth and nice healthy gums, nice and pale pink, sharp in between the teeth, no bleeding. We want to be removing the bacteria which is in the plaque. So when you're brushing, you're angling the toothbrush towards the gum at a 45-degree angle. You're being nice and systematic to get round all of the mouth, including behind the back teeth, right at the back of your mouth and behind the bottom front teeth. Brush twice a day, once just before bed and at least another time throughout the day for at least 2 minutes each time. Clean your teeth in between every day using tight fitting little brushes that clean in between, several strokes backwards and forwards. Don't rush it. With a brush that's the appropriate size for cleaning in between. It should be a snug fit. And then hopefully that'll get you back looking nice and healthy like this for the next time we're able to see you in the practice. In the meantime, keep brushing, keep cleaning in between and stay safe.